Chapter 6, again, another fairly easy chapter. Go to page 103 of the textbook, which is the first page of chapter 6, and it defines what public health is. Public health is defined as organized community efforts aimed at the prevention of disease and promotion of health that focus on society as a whole, the community, and the aim of optimal health status. Okay. In a nutshell, it's prevention. Preventing mass breaks of communicable disease outbreaks, prevention of disease transmission, prevention of chronic disease, prevention of whatever. Okay, whatever public interest may be at that time, or whatever government interest may be, um, or private entities. Okay, public health happens at the state level, at the national level, at the public level, and at the private level. And a lot of different organizations have their hand in different public health interests. Again, just sit back and think about how public health affects you in your daily life. Two things that come to mind are clean water and clean air. Those are public health initiatives, and those are things that we don't really think of, but those are public health initiatives. Making sure that there's clean water in our drinking water pipeline, obviously separated from raw sewage water that we flushed on the toilets, and then also clean air. You drive over the bridge over there near JEA, you see those two large smokestacks. There's certain environmental standards of whatever those pollutants are or whatever's getting put out into the atmosphere. They have to meet a certain level of non-toxicity. Talked about that already. So when you talk about public health, it's much different than the role of individual medical care. Individual medical care is what we've been talking about pretty much for the first 4 chapters of the textbook. When somebody goes and sees a physician for medical care and that one-on-one exchange of the healthcare services versus public health are services and initiatives that are implemented within large populations of people. And so with this table right here talks about the difference between individual medical care, public health, and also from a primary, secondary, and tertiary prevention standpoint. No matter what the public health initiative is, or a public health issue, it all comes back to this right here. This is how programs are rolled out, and this is pretty standard with any program or with any initiative that takes place in a public or private entity. You define the problem, identify what causes the problem, and also is there any protective factors that are working in conjunction of keeping that issue, keeping the issue going. Then you develop testing and strategies around your interventions, right? Some sort of a pre-test where you look at data before you roll out your intervention, and then you implement your intervention. And then you, after whatever the intervention is, or after the program of whatever the public health program is that's been implemented, you then retest it to hopefully show a difference that the intervention worked. And then you sort of redefine, do we have to go back and retool because whatever the intervention was didn't work? Did it work and you want to have it refunded to keep it going? So you sort of redefine the problem and look at your data, and then you start the whole public health circle over again. So keep this graph handy when you're taking your exam. Like I mentioned before, there's a lot of private and public entities that are involved in public health. States are left up to their own accord to run their public health programs, except for in special circumstances when there's already federal programs or federal agencies in place. For example, the FDA, right, the Food and Drug Administration. A pharmaceutical entity cannot roll out a new drug in one particular state because the state law will say, yeah, go ahead and roll this out, while other states say no. Something like that is a federal law. once a drug, whether it's over the counter or a prescription, once it's available for mass public use, it has to be approved on the federal level, and then it's rolled out, countrywide and at the state level. But not everything's that easy. There's a lot of private and public entities that are involved in public health, right? Just look at there's 4 or 5 different charts, not only in here, but I believe also in the text, starting on page 120, right? There's a lot of agencies involved with public health and public health initiatives, whether it's the entity that is actually driving the public health initiatives, such as healthy weight loss and NIH grants, and CDC, meaning the Centers for Disease Control. Okay, and all the way, pretty much any public health issue, there's a federal agency that's responsible for that. A lot of federal agencies, again, at the law and regulation level. I mean, there's a lot of entities that have a lot of hands in public health issues. Okay, from the state level to the federal level, public and private. And there's a lot of gray areas on what works and what doesn't work, because a lot of these agencies just don't talk to each other. And that's one of the issues with public health in the U.S. is lack of communication, because a lot of these public and private agencies, they work in their own isolated silos without a lot of discussion going back and forth. This right here plays off of that other graph that was primary, secondary, tertiary prevention. Just gets into some examples within the healthcare community of what primary, secondary, tertiary medical programs are, and again, know that for the midterm. There are core functions of public health: assessment, development, advocacy, enforcement, making sure that the implementation is of a program is correctly implemented, and that it whatever the public health entity is, that it's adequate. And think back to Hurricane Katrina in New Orleans, and some of the emergency responses of the city of New Orleans was deemed that it was very inadequate. And so now there have been public policies at the government level that have been implemented as a direct result due to the inadequacies of the emergency response team for the city of New Orleans. Okay, because public health initiatives should have had some much better response in place, especially when there was a lot of flooding and people had nowhere to go. So, cores of public health initiatives, the 10 essential public health services. We don't really get into that in the midterm. Again, just make sure you understand primary, secondary, tertiary injury prevention programs, and our circle of public health activities. Okay. Also, it's I believe we discussed this in class, or we will when this chapter comes up, that the United States is vastly underfunded. Our public health program is vastly underfunded. We do not focus on prevention as much as other countries do, especially when it comes to chronic disease prevention. Okay, so per capita, the United States is by far underfunded compared to some other countries in their public health programs as far as per capita expenditures. Okay, there's a direct correlation between a country's life expectancy and the amount of money they put in their public health programs. But we do not do a good job of that, because again, a lot of our money, especially public dollars, is tied up in Medicare, Medicaid, and healthcare dollars. I'm talking about government services, the challenges of public health, like I just mentioned before, improving the infrastructure of public health, meaning that it's underfunded. Duval County. Go online. I don't know what the website address is off the top of my head, but Google Duval County Health Department and see what different programs we have in Duval County, and what we have available in Duval County. It's a pretty interesting website. I forget what it is off the top of my head, but just Google Duval County Health Department. So again, pretty easy chapter. The last part of this of the slides here is just something that the book had put together, kind of comical, talking about public health, what it needs to be prepared for. A lot of organizations have performing a lot of different functions within communities to try to keep them healthy. But the big thing that we have right now, of course, is chronic disease prevention. Childhood immunizations, the return on investment is 1 to 27. So for every $1 we spend on childhood immunizations, it saves $27 of medical expenses further down the line. So for example, with Medicaid programs and well child visits, there's a lot of immunizations that are approved in Medicaid well child visits, and just well child visits as a whole, whether it's Medicaid or private insurance. But not all vaccinations were approved in Medicaid, and so now that the data has shown to have a 1 to 27 return on investment, there's a lot more of those immunizations, and now this concept of well child visits over the past 10 to 15 years that now Medicaid supports. So relatively easy chapter. The chapter mastery quiz is not that difficult. It's pretty straightforward. Public health and a lot of policies, and then practices, which leads right into the next chapter, chapter 7, which talks about health and behavior. But again, another easy chapter. Chapter 6, email me with questions, comments, and concerns.